Hello, and welcome to Frontiers in Health and Happiness, the official podcast of the Lee Kum-Shung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. My name is Ayla Fudala, Center Communications Coordinator, and I'll be asking experts how to live a healthy, happy life. Today we'll be continuing our loneliness and well-being theme and discussing how loneliness can impact our health as we get older. As we mentioned in our first episode, loneliness is associated with many negative mental and physical health impacts. That's why it's so important that our society investigates the causes and effects of the growing loneliness epidemic and comes up with innovative ways to address it. Our guest today is Dr. Louise Hawkley, a principal research scientist at the National Opinion Research Center and a specialist on loneliness and health during aging. Dr. Hawkley currently serves as co-investigator on the National Social Life, Health, and Aging Project, a study of health and social factors among older adults in the United States. I began our conversation by asking Dr. Hawkley, why is loneliness so important?
Loneliness is important for a lot of reasons. I think anybody who's feeling lonely at any given time would be able to tell you how miserable it feels, how it leads to less than desirable kinds of behaviors, because when you don't feel you have anyone around you, you start filling in with perhaps behaviors that aren't so healthy. Maybe you're overeating, drinking too much, maybe you're not getting the sleep you need. Maybe you're spending too much time in front of the television screen or the computer screen, things that aren't actually profitable for your social health. But then the bigger issue is also that loneliness leads to poorer physical health outcomes. So especially if you're chronically lonely, you typically are going to be at a higher risk for mortality. You're going to die sooner, but also just health in physiological signs and symptoms, like things like your cortisol system, it gets out of control, and your blood pressure maybe gets out of control. We see that people who are lonely tend to be more likely to develop cardiovascular disease and stroke. And now data is starting to show they're more vulnerable to diabetes as well. So there are these long-term effects, especially for people's loneliness that's measured when they're getting older.
Is social connection the solution to loneliness?
Social connection is a big word, and yes, I would say if loneliness is a symptom of anything, it's a symptom of social disconnection. There are lots of ways of connecting, but yes, that's what you would want to do, is find a way to connect, and that could be on an individual level, it could be an intimate partner, it could be close friends, it could be finding a group that shares an activity with you or shares a belief system with you that you get together with regularly. So those kinds of connections are all helpful. We, as humans, we're wired to be connected to others, that we need each other historically or from an evolutionary perspective, we needed each other to even survive. But we need each other continually, even to this day, to thrive, to be able to achieve all that humans are capable of achieving, which is always better and more if done in cooperation with others. So we have this innate motivation to connect with others, and that's a good thing because that's exactly what we need to satisfy our humanness.
How can we help older adults experiencing loneliness?
It could be as simple as, in the case of, let's say, older adults who are housebound, they can't get out to do social things in a social context. They need transportation. How many of our cities lack the kinds of conversation that will go door to door, not curb to curb, because this older adult won't be able to get down the stairs and down the curb? How many of them are going to be able to get them from the door of their home to the door of the community center where they can have lunch with friends? Those kinds of things are really important.
Can you give an example of an intervention to help older adults?
If somebody comes to the door, this is less and less often now, but if somebody comes to the door, drops off the food, and leaves, it has not as much of an impact as coming to the door, coming in with the food, or at least chatting with the person before having the food delivered, and maybe doing it more than once a week. The dose response. So those older adults who are isolated and rely on somebody to bring their food benefit from seeing that food delivered more often because they get a social interaction with who's delivering it. So that's another way that this can be addressed.
How can we promote social connection in our day-to-day lives?
I think the best way is probably just to model social connection, to model attempts to connect in a real way. It's so rare to have people who don't know each other just pass some pleasantries. And I think doing that in all contexts, work, community, family, breeds more of the same. You're inviting other people to engage with you, makes them feel good and makes them want to engage in turn.
What can public health students and professionals do to help promote social connection?
I think the job of public health professionals is to understand what is happening at a larger scale, I guess you could say. What is it about our communities, about our states, about our country that can be modified in a way that helps people connect with each other? A small-scale example might be a city that decides, we're going to create walking paths that have benches, places where people can actually stop and have a conversation. Not promote the as fast as you can get there and don't talk to anybody on your way there, but rather, here's a place where you can actually take a break and somebody might actually talk to you, or you might want to talk to somebody. Make it appealing, make it green space, make it a park. Whatever little nudges like that that can be introduced into the environment can go a long way to encouraging the social activity, the social interactions that would normally not happen.
Loneliness has been proven to be a serious public health issue. So what is our government doing to address it?
Well, the Surgeon General has certainly taken the government's perspective in releasing that report that basically says, this is an advisory. We have a problem. We have to do something about it. And I think he's laid out, Vivek Murthy has laid out what some of those changes could be. And part of it would be just supporting, whether financially or in principle, supporting local efforts. Communities are trying to do work in this area. They're trying to help people find ways to connect with others. What they need is money, and they need recognition that what they are doing is important. And the more that that is recognized, the more the community members will actually realize this is a resource that is there for them.
Dr. Hawkley, what are your plans for future research into loneliness and social connection?
I think the most interesting for me right now, there's two things, but the first is getting a better understanding of how the social world is changing with successive cohorts. We've been running this National Social Life, Health, and Aging project since 2005. We brought in the so-called silent generation, those born between 1920 and 1947. Then we brought in the baby boom cohort, 1948 to 65. We now want to bring in Gen X, born from 66 to 80 roughly. So each of those generations, and that's using it in a very broad term, it's a lot of years in each of those cohorts, but with each successive cohort, the social environment in which they've developed and which they are living has changed a lot, as well as everything else about the world, the political environment, the health environment, the medical advances that have been made. But in any event, looking over time to better understand what are the universals? What is it that protects people's sense of social connectedness? If it has changed with this younger and younger or newer and newer cohorts, in what way? Or are they, by the time they reach old age, are they going to look just like the baby boomers did when they were that age? Or like the silent generation when they did at that age? There's reason to think they probably won't, but that's an empirical question. We have to understand the life course trajectory of how people connect in a world that is changing all the time.
It's reassuring to know that experts like Dr. Hawkley are researching both the problem and potential solutions, testing out interventions to help those who are most impacted. Whether you're a policymaker, a public health professional, or just an everyday citizen like me, I encourage you to think of ways you can provide social support for the people around you and help to build a more connected society. This has been another episode of Frontiers in Health and Happiness, the official podcast of the Lee Kum-Sheung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. To learn about upcoming events, visit our website, sign up for our mailing list, and follow us on LinkedIn, X, Instagram, YouTube, and Facebook. In the next installment of our Loneliness and Well-Being series, I'll interview Dr. Koichiro Shiba, Assistant Professor of Epidemiology at Boston University, and an expert on the intersection of loneliness and health equity. New episodes in our Loneliness and Well-Being series will air every 2 weeks. Episodes can be found on the Lee Kum-Sheung Center for Health and Happiness website and YouTube channel, as well as on Spotify, Apple Podcasts, and wherever else podcasts are found. Thank you for listening.